And I'm a physician, and I'd have to go back to the office without a tooth. And I said, well, that's not an option. So they sent me to Dr. Kaczynski, and he was able to immediately, after he put the bone in, he sent me back with a tooth basically there, a flapper, but then they put an implant. Once I grew up a little bit of bone in there, they could put an implant in with a false tooth there, so that it looks just like a real tooth.
Now, how long did that procedure take?
The procedure with the drainage?
The implant and, well, almost the whole thing. How long from when you found out until?
Well, after they first drained the abscess and had to put the bone graft in, you had to let it grow in for a little while, and I had a false tooth, but something that none of my patients could tell. In fact, my father thought it was so good, he didn't even see the reason to go back and get the implant. He was like, it looks great. I said, yeah, but it's kind of like having a tooth that you could take in and out. I said, no, Dad, you know, I'm only 38. I don't want to go around with a false tooth that could come out. So then when I went back to him, in the office it takes literally, usually, by the time he numbs it, it takes 15 minutes.
Wow.
And so then they just put the implant in and put the false tooth.
Is it one of your front teeth?
Yes, it is. Most patients.
No, I can't even tell.
It's just one tooth in the front?
Yeah.
I don't know which one it is.
Yeah,
and it's better than my original crown that I had. So this fake tooth that's in there right now. Yeah.
So she needed bone grafting.
Right.
What is that?
Bone grafting, there's different types, but basically it's a material. We use a synthetic material that's placed into the jaw, and it stimulates your own bone to grow into it. Bone is a living organism. It's constantly being eaten away and rejuvenated. It's alive. And it's a substance that's put into an area when you're missing a tooth, and it grows the bone back over a period of time. Gives us a foundation to place the implant.
So it's similar to skin graft, like skin graftings?
Yeah, for bone though, like a skin graft, but for bone.
I always wondered.
Yeah.
And Dr. Joslin, you had an infection in one of your tooths. Yeah. So this sort of thing could be useful not only to someone who may not have taken care of their teeth, but this sort of thing could happen anyway. Anybody could have this need for a tooth replacement.
Yeah, yeah. Because I mean, I had a crown, just like you talked about the trauma. I had a crown placed because I had tripped down the stairs when I was young and had broken the root, and they had to do the whole root canal on the crown. But then later on, an abscess developed, just kind of out of the blue. And before I realized it had taken away most of the bone in that front part of the jaw. So, I mean, it was a very happy ending for me because I really was worried when I spoke to that endodontist for there being a period of time where I wouldn't have a tooth or something that wouldn't look aesthetically pleasing.
And that was the first you learned about these implants.
Yeah.
Amazing.
And they said he was great. They said he's the best around. So.
Well, your legacy precedes you.
Well, it's really exciting. Again, going back to exciting technology, being able to use something, numbing just the area. It's not painful afterwards. It
not
really
at all.
isn't.
In fact, he gave me pain medicine. I never used it. I never filled it on.
And most patients feel that way.
And you could speak afterwards too.
Yep. Yeah, I was completely fine. The drive home, it was a little bit numb. I got home, I was completely fine.
Wow.
What do you use to numb it? Just that area? Do you use a needle or?
It's a needle, but we use topical. You don't even feel the shots anymore.
No, because you apply the topical gel first, which numbs the skin.
There's no reason to be afraid of going to see the dentist anymore. It's really, really pain-free dentistry today. Even a major surgery like a dental implant that you would expect to be very complicated and is not. It's very routine and very simple today.
You were able to eat that same day then?
Yeah,
right on it?
Amazing.
Yeah, they said, stick with soft foods, but I just kind of ate my regular food in the back case. Hate to tell you. But no, I did just fine. That's right. We don't follow any rules.
And so you are a doctor. What did you think when you learned about this procedure? Was that particularly exciting to you?
It
Not
was
just
very
for
exciting.
personal reasons, but as from a viewpoint of a doctor.
Yeah, because in medical school we learn, obviously a lot about a lot of other body systems, but not dentistry. I mean, I'm limited to like my knowledge of, if it looks like an infection or how many teeth you may have in your mouth at each stage of your life. That's about it. So, and he gave out a booklet on what the procedure all entailed, so it was very informative that way, and I really learned a lot from his booklet. And it does, obviously it is a surgical procedure, so it looks like it would be uncomfortable, but really, I mean, once the numbing procedure happened, I was fine after that. So.
Incredible.
So once these dentists go to your school, or the school, and they learn how to do this, can they now perform it in their own offices?
I would hope that they do. We are mentors, and what that means is that we're always there when they need us. We teach them their limitations. We don't expect them to do very complicated cases until they become more confident and more competent in their abilities. But absolutely, positively, when they leave our program, we want them to be treating their patients.
So will they come back to you for more training when they need to do those
we have other phases, more complicated cases that we like them to come and visit us and learn. The more education you get in dentistry and medicine, the better you are, and your patients want to stay with you.
Now, is there a sort of certification that they get that maybe a patient could look out for to make sure that before their dentist says, I can do this, to make sure that they really are qualified?
That's a great question, and the answer is really no. There's a lot of organizations. Implant dentistry is not a specialty. There's a lot of different specialists that do implant dentistry: general dentists, oral surgeons, periodontists, endodontists, prosthodontists. There's a lot of specialties in dentistry like there are in medicine, and so there's a lot of quality people. The best thing to do is ask family and friends about their dentist. Check the internet. There's a lot of good information out there. And have multiple consultations with different dentists until you find somebody that you're comfortable with. I think it's important that the dentists show their own work. I would ask them to show cases that they've done. I think that's very, very helpful to find somebody that you feel comfortable with. So but that's true in medicine too. You should see who's the best at what they're doing.
Yeah, I really think the word of mouth really is how most, at least in the medical world, how things spread is by word of mouth from other patients, other physicians.
Good thing to do. Take care of yourself. Right?
Absolutely.
So how do you know when your dentist might be a little behind the times?
Boy, that's not a fair question to ask me. I think
because people have to watch out.
Again, I think you need to look at their office. You need to look at technology. You need to ask questions. You know, you talk to your family and friends. There's most dentists are very well trained and very capable and very caring people. So you have to look around and you have to ask.
Now, my dentist for the first time had measured my gums with numbers. And I had never had that before. Do
you know why that is, Krista? It's because you're getting older. No, they're measuring the health of your gums. And we have to find a baseline to start with, and then we'll know if things get worse as time goes by. Okay. That's very important, that your hygienist does that.
Yeah, it was comforting. Yeah. There's a big poster up there telling me
how
numbers, what good numbers are and what bad numbers are.
Exactly.
Okay.
So while we're on that, what kind of, first of all, hoping you can leave us with some good messages here. How often should you see your dentist, and what should you do in between those times?
Well, I think it's very, very important. You see your dentist as often as you need to, and your dentist or your hygienist will be able to tell you how often. Some people need to be seen more often. Home care is critical. You need to maintain your teeth. You have to take responsibility. It's your body. If a physician gives you medication, you have to take it, or it's not going to help you. So use the tools that are available, and it may not be a standard toothbrush anymore. It may be something more exotic. You have to try and find out what's best for you.
Well, thank you so much for joining us today. It was great to meet you.
Thank you, Matt. It was nice meeting you, too.
Thank you so much.
Nice to meet you, too.
If you'd like more information, you can go to their website at www.smilecreator.net.
Thank you so much.
Thank you.
We'll see you next time.